A major bipartisan bill passed on Friday will force the government to fund cutting-edge medical research. Congressman Andy Harris joins us here now. He's one of the sponsors of this bill. Thank you very much, Congressman Harris, for being here. How are you?
Pleasure to be here with you.
You're also a physician, so this is certainly something with which you're intimately aware. What are your thoughts about this cutting of funding for cutting-edge research?
Well, I think what we need to do is it's time, the technology's coming together, it's time to really cure some diseases like Alzheimer's disease. We're on the, again, on the edge of curing a lot of cancers, making major steps forward in heart disease, and we're going to provide some more funding and do some more research.
How will this happen? Explain how the bill works.
Well, what it does, it takes current NIH funding and then adds additional about $2 billion a year, a little over $2 billion a year, and focuses it on those areas, Alzheimer's disease, heart disease, diabetes, those really, the ones that are big ticket items for our government, for Medicare, Medicaid programs, but also ones that affect millions of patients nationwide.
Right. What are your thoughts in terms of this bill before Congress, obviously very important. What are your thoughts about whether the Affordable Care Act will either help or hurt the efforts that are being made right now?
Well, I will tell you, this is one piece that was left out of the Affordable Care Act. Obviously, you know, we need to get the insurance side right. But wouldn't it be better if we could just cure the diseases so you didn't have to go see a doctor or get health care? That's right. So that's what this bill does. It goes way beyond the Affordable Care Act to get really at the root and the cause of disease, hopefully to solve some of the really big ones.
Look, as a physician, and you and I have had an opportunity to talk about this before, ideally, you'd like people, as you're saying here, to be healthy in the first place and not have to go to a physician. Is that something missing from our discussion about health care today, Congressman Harris?
It is, and again, I hope what we find out as part of this Cures and Innovation Fund is we find out how to avoid getting Alzheimer's disease, how to avoid getting, we have no idea, for instance, you and I, next year, God forbid, we could get Alzheimer's disease. We have no idea, but hopefully we can find ways to prevent, and if you get it, ways to cure.
Right, and will insurance companies obviously fight with patients over a lot of things. Is this something that you think would be funded by companies if it's proactive enough?
I'll tell you, we won't need the companies because we have found savings elsewhere in the government. We have found we've made other cuts elsewhere to pay for this research because this really should be a high priority.
Right. Alzheimer's is also important. What about other diseases such as diabetes, heart disease, things like that?
Sure, all of them. These are the ones that affect millions of Americans, add cost to our healthcare system, and in the end, it's the right thing to do, to help people stay healthy, or, God forbid, they get one of these illnesses, to cure them.
All right. Congressman Andy Harris, thank you so much for being here. We absolutely appreciate it. We'll see you again soon.